When you talk about value-based reimbursement, the biggest barrier is general understanding of what is value. People understanding what exactly it is to perform. So when you're a payer, you're trying to pay for good performance. When you're a provider, you're trying to pay for and get paid for good quality performance. Mutual understanding of that is something that really stands in the way. So one of the things we'd like to see as VBR progresses or value-based payment progresses is the ability to take better performance metrics and agree early on what they look like and pay for it based on value. There is a shift towards value-based reimbursement, but it's going to take time. And when we talk about some of the obstacles, again, not just an understanding of what value is, but the infrastructure in place to administer that just simply doesn't exist. Today, a lot of, for example, health plans are working with providers on an ACO model or accountable care model, and most of that's handled by spreadsheets and simply disaggregated data. And being able to bring that together with an infrastructure that is shared and a technology that gathers the data at scale is extremely difficult. Well, I think the transition starts with being able to look at all the experimentation that's happening today. So there's a lot of different models for payment when you talk about value-based reimbursement, and it means many things to many people. So you've got bundled payments, episodes of care, fully capped relationships, accountable care organizations themselves. And so to help progress that further, I think you see a lot of the experimentation happening. Those have to show real results, and then those results are going to be the basis for enabling the infrastructure to help that scale. So being able to accelerate that means being able to use technology, be able to use content, to be able to come together in different types of relationships that show those results, and then be able to scale it out. Well, obviously there's a lot of players from a financial perspective. Obviously you have the consumer themselves, the employer, the payer, and the provider. As employers move to exchanges, they're really taking that burden off of themselves and really putting it onto the consumers themselves and also the providers who are part of those plans. And so as you move to exchanges, it means more responsibility for both the consumer, the provider, and the payer. In that world, the payers who are not paying on a value-based model are not necessarily getting the appropriate utilization. They're not necessarily getting the efficiencies that they need to be able to reduce their administrative costs and their MLR. On the provider side, those that are not today engaging in some form of value-based reimbursement, that are stuck in a fee-for-service model, are not developing the chops that are needed to be able to progress in that world. And in fact, those hospital systems that today are maybe building new infrastructure or a new tower or a new facility, they need to be thinking about cutting costs. They need to be thinking about being able to prepare to turn their outpatient facility today into a very consumer-oriented, retail-oriented approach, which if you're not doing that today, you're going to get left behind.